Hi everybody. So chapter 13 is about the special senses. There are 5 different special senses: sense of smell, taste, vision, hearing, and balance. So in this chapter, we talk about only the vision and hearing. Also balance will be discussed. So the sense of smell and taste will not be discussed. These are the terms that you guys should study and memorize it. So I will start with here with anatomy and physiology. So if you look at the eye has accessory structures and the eyeball itself. Accessory structures are eyelids, so you have upper eyelid and you have a lower eyelid, and you have also the eyelashes here just for protection against foreign bodies. Eyelids are usually covering the eyes and then removing any foreign bodies, protecting the eyes, lubricating the eyes, providing nutrition. So there are some glands around here that provides nutrition and also distributes tear. This area that you see, this white area that you see, that's called conjunctiva. This conjunctiva, so half of the conjunctiva is in the eyelids, the other half is above the eye itself. So this area that you see, this is called cornea. In this image, if you can see, it says that conjunctiva is on top of cornea, which is wrong. Okay, so conjunctiva stops here up to here, and starting from here it goes like this. So it reduces friction on the eyes when the eyelid is moving against the eye, and also it has some glands and provides some nutrients, but it does not cover the conjunctiva, the cornea itself. So that's actually a mistake there. The eye itself has 3 different layers and 2 cavities. So this is one layer. This is the most superficial layer. The anterior part is made of cornea. Cornea is a clear layer, and light can pass through it. And then is the sclera, and the sclera is area that here is the the writing. The sclera is made of dense irregular connective tissue and is hard and thick. The eye muscles attached to it. Also, it keeps the shape of the eye. The second layer is called the vascular layer. So starting with the iris, this is the iris. Inside the iris, there's an opening. That opening, light passes through it, and that's called pupil. And this is the color area of the eye. That depends on the pigment. Everybody's eye color is a little bit different. The second part is called the ciliary body. Ciliary body is made of the ciliary muscles around here, and also ciliary processes around this area. The ciliary processes are attached to these ligaments. These are called suspensory ligaments, and then these suspensory ligaments go and attach to the capsule of the lens. And this lens is located behind the iris and pupil, and it's elastic, and the thickness of the lens changes and depends on the light, the amount of light that is coming from close or from far away. The thickness changes, so the light can pass through and focus in this area that is called fovea, and that is for central vision. It means everything can be seen there very, very sharp. The third part of the second layer is the choroid layer. This is the choroid, and this is how it's spelled. Choroid is very vascular and provides nutrition for the inner layer. So inner layer is made of retina. There's also a pigmented layer here. It's not shown there. So these are made of different photoreceptors that are responsible for processing light. and then there's different neurons there, and these are the fibers of those neurons that makes the optic nerve. And inside the optic nerve, you can also see the blood vessels that are coming and supplying retina. So retina is supplied by both the blood vessels and also by the choroid layer. Excuse me. There is the two cavities that I was talking about. It. One is the anterior cavity so it's from the back of the cornea all the way to the lens around this area. This is called the anterior cavity. Anterior cavity is made of two chambers. So this is the one is anterior chamber, which is from cornea all the way to iris, and that is the posterior chamber, which is from back of the lens all the way to the iris. So these two chambers together makes the anterior cavity, and there is a fluid there, and that fluid is called the aqueous humor. The posterior cavity is this big area, and that is made of the gelatinous protein and some fluid, and that is called the vitreous humor or vitreous body. The function of the vitreous humor is to compress retina against choroid, so the retina is getting nutrients and oxygen through choroid layer, and also it reduces dispersion of light or light fractions. It's reduced there, so it can focus, the light can focus easily there on top of retina. These are the muscles of the eyes. It's better to see this image actually from anterior view. It's easier to see. They have four different recti muscles. So this is the superior rectus, which is also this one. This is moving the eye upward. This is inferior rectus, which is also this muscle, and that's moving the eye downward. This is the medial rectus, which is hard to see. They can see this dark brown in this area. This is moving the eye toward the nose, and this is lateral rectus that moving the eye laterally, which is this muscle. There's also two oblique muscles. One is called superior oblique. This is superior oblique. This is superior oblique that moves the eye like this. It's called intorsion. And another one is called inferior oblique, which is this one, and that's moving the eye outward like that. That's called extorsion. So intorsion like this, and extorsion like that. Okay, so now is the glands here. There is the lacrimal glands. One is the superior lacrimal gland, and this is inferior lacrimal gland, and that produce tear. Tear is going through these ducts, small ducts. These are called lacrimal gland ducts, and that's distributed in the eyes. It contains some antibodies and also some lysozyme, so that will clear the eyes from any kind of infections and also clear the eyes from any kind of foreign body. It goes through these small holes. These are called punctum. The plural form is called puncta, P-U-N-C-T-A, and that goes through these small canals. These are called canaliculas. The plural form is canaliculi, small canals. These are written here ducts, but it's not ducts. It's called canaliculi. Then it goes to the lacrimal sac, and from there it goes to the nasolacrimal duct, and here it drains in the nasal cavity. This is how light reflects on the eye. So if you see something like on a tree here, it goes through the eye. It breaks one time in the cornea, and again the second time on the lens. And when it focus on top of retina, everything is flipped. So the upper part is lower on the retina, the lower part is in upper retina, right is on the left side, left is on the right side. So everything flips. And then the information from here, it goes to the brain, and then the brain processes the information correctly. So different specialties in the eye field. One is ophthalmology. Ophthalmology is studying diagnosis and treatment of eye diseases, and the person specializing in that is called ophthalmologist. This person has to have a undergrad study 3 to 4 years, then go to medical school 4 years, and then so 5 years of specialization in ophthalmology. Optician is somebody that is usually trained on the job, or maybe a 6 months college or some specialized training in some community colleges, and then they're trained for grinding and fitting corrective lenses, and they also participate in sales of lenses and contact lenses, prescription eyeglasses, I mean, and lenses. Optometry is the science of examining visual acuity, and it means that how a person can see things accurately. It is important for myopia and hyperopia, and they usually prescribe different type of corrective lenses for vision. And the person that is specializing in that is a optometrist, and they go under 3-4 years of undergrad, and then 4 years of training as an optometrist. Signs and symptoms. One is called presbyopia. This is a very common symptom, and as the person gets older, they usually have vision loss. The elasticity of the lens decrease, and that's why they have a difficulty seeing things correctly. Nyctalopia means night blindness. There is 2 types of receptors in the eyes. One is called cones that are processing color, and also they are sensitive in a higher amount of lights. The other one is called rods, and they cannot process color, and they are responsible for seeing things in the low or dim light. So in these patients, they have difficulty with rods, and as a common cause of that is vitamin A deficiency. Blepharoptosis. Blepharo is eyelid, and optosis drooping. So this can be a cause of cranial nerve 3, but also older age may also cause blepharoptosis. Papilledema is it's called choke disc. What is an optic disc? Optic disc is the area that cranial nerve 2, which is the fibers of the neurons that are in the retina leaving the eye, and that is the area that's called optic disc. So if that area swells up, it means the person has papilledema, and the reason for that is increased intracranial pressure, for example, from trauma or tumor. Xerophthalma. Zero means dry, so this is a dry condition of the eye. If you are using electronic devices for a longer period of time, including your cell phone or tablets, computer, or even TV, and that way you blink less, and that will cause dryness of the eye. Also, some autoimmune disorders that can also cause dryness of the eye. Amblyopia is the laziness of the eye. So here the eyes are okay, but actually there's a problem with the brain, that the brain cannot process one of the eyes, the information that is coming from the eyes properly, and thus the person usually does not know it until an optometrist or ophthalmologist diagnose that. Strabismus is weakness of one of the eye muscles, so the eye muscles may go inward or outward. So this is why it's 2 types. One is called esotropia, which is the moving the eye inward, and exotropia, which is the moving the eye outward. So this is the eye that is looking anteriorly or directly at you, and these are the affected eyes. So these are the types of the strabismus. So if a person has a strabismus, then the brain will not process the information from these affected eyes properly, and that's why you get amblyopia. And the nystagmus is the movement of the eye, so like this is going like this, going back and forth like that, and usually it's a problem with the brain, not the eyes itself. It may go in a horizontal or it may go in the vertical direction. Emmetropia means that whatever you see, it focuses directly on top of retina, so you can see things very clearly, and that is called 20/20 vision. But not everybody has this problem. About 2.2 billion people in the world may have one of these three conditions. So it's very, very common. It's the most common type of vision problems. So hyperopia, it means farsightedness, and this is that condition that you can see the image behind retina. So these people can see things far away correctly, but if they see things close by, they have a problem with that. So these patients may need biconvex lens, and that way the object can sit on top of the retina and can see things clearly. One of the main reasons for these patients is the anterior posterior diameter of the eye is very narrow, or the lens is very flat. Myopia, which is much more common, is called nearsightedness. So here the object is in front of retina, and that's why things are blurry when they see things from far away, but things that are close by, they are okay. So to correct that, we need a biconcave lens, and then the object can focus on top of retina. And there is another different condition called astigmatism. Here the cornea is not smooth, it's a little bit curvy. They have different curves, and that's why when the light hits and passes through the cornea, it cannot focus, the light cannot focus in one area, it focuses in multiple different areas, and that's why the person has blurry vision. So that is a common condition that comes with myopia. Legally blind, it means the person cannot see things properly. If a normal person can see an object from 200 feet, then a legally blind may have a problem seeing that object from 20 feet. And I will come back to this, what this actually means. So when I show you the chart, the Snellen chart, I will come back and explain this again. Achromatopsia means that a person has color blind, and the most common color blindness is the red, but it can also be other colors, and that's much more common in men than women. Retinal detachment, it means separation of the retina from choroid layer. This is really bad. That will cause sudden blindness. It's more common in patients who have myopia, and you have to treat the condition right away, because if you don't, retina cannot get enough blood supply and can cause permanent vision loss. Retinitis pigmentosa means that there's pigment forms in the retina. You can see these pigments, and that will cause also vision problem. And macular degeneration is that the macula is usually damaged, and macula is the part that has a lot of cones, so that's for central vision. You can see things very clearly, and if that is damaged, then the person cannot see everything clearly, so they have to use their peripheral vision to see things. Hemianopsia means that they can see only half of the visual field. So this is one visual field, and this is another visual field, and you can see that they cannot see everything correctly. And there is a problem with the optic nerve, so all the optic tract area that the nerve fibers goes to thalamus, or from the thalamus goes to the cortex of the brain. If it is damaged somewhere, and then they may get different types of hemianopsia. There is like multiple different types. And retinoblastoma is that it's a tumor of the retina, it's a malignant tumor, and you can see the pupil, and the pupil looks whitish in color, and this happens in children younger than 5, and if it's not treated early, that is a cancer, so it can kill a person. Cataract also, you can see, if you look at the pupil looks whitish, but this you see it in older people, and this is, the content of the lens changes. The lens become very thick and opaque, and the light cannot pass through that, and they will have a vision problem. So visual acuity is damaged or reduced. Glaucoma's increase in intraocular pressure. It's acute and chronic. You can see the pupil size is irregular. There is a lot of redness around it. They have cloudy vision, so that's glaucoma. The chronic forms usually do not have this kind of symptoms. They gradually have vision loss. So glaucoma, the chronic ones are more difficult to diagnose than the acute one. And uveitis, inflammation of the choroid layer, which is the second layer. And again, you can get redness of the eyes. So you may not get blurry vision exactly, but you may get redness of the eyes. Pterygium is increasing size and formation of the conjunctiva, and conjunctiva go through the cornea. So now this is the cornea, this is a clear layer. The brown area that you see, that's the background iris, and this is the pupil. But this light, you see the light reflection, that is the cornea, which should be like this. But here the conjunctiva is growing over cornea, and this is a benign condition. You see that more in area that's a lot of sunlight. So if you're going to the beach a lot and not using UV light protection for your eyes, this condition is much more common. Hordeolum or stye is an inflammation of the sebaceous glands. Sebaceous glands are located here. They are producing oil, and they are in the eyelids, so that is for lubricating the eyes, the superficial layer of the eyes, and providing some nutrition. But this is a bacteria grows and becoming red and painful. Conjunctivitis is redness of the the eye looks reddish or pinkish in color. That is inflammation of the epithelial layer of the eye that is covering the sclera and eyelid. So it can be from allergies, it can be from viral infection. Both of them will produce clear secretions, but if it is a bacterial one, it will cause a yellowish secretion, which is much more dangerous. This is the different type of eye examination. One is called the visual acuity test. That is to test how sharp is your vision, how clearly you can see that. And for that, you need to use Snellen chart test, which is this one. So for this, you have to stay about 20 feet away, and then you start reading, from the big letter, and then you go down, 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 up to you get to 2020. So if you can read this line from 20 feet, then you're in good shape. But a person that is blind cannot read this from 20 feet. Normal person should be able to read this from 200 feet. So that is how people have different vision. Some people can read even these ones, and they have better than normal vision. Also, you see these red and green ones, and these are for color vision. So you want to test if you are color blinded or not. So that's why they put these two. And also there's another test for color vision, and you can see this, and it's written 35, and if you cannot read 35, it means you're color blind. No, I'm joking, it is 27, okay. Ophthalmoscopy is this device, and it has a light and it has a lens there, and you can see, you can put a light and then that light pass through, and that you can see the lens, but more importantly, you can also see a retina, and you see if there is any kind of damage there because of hypertension, because of any tumor, because of diabetes. So different conditions, papilledema, there's a lot of different things that you can see. Refractive error test is that if you have myopia or hyperopia, you go to an optometrist, and then they put different lenses, and they can look at your vision and see how sharp you can see different letters or different objects. So they give you prescription eyeglasses. Tonometry is to check the pressure of the eye, and that is for glaucoma. Keratometry is to look at the curvature of the cornea. So people who have astigmatism, they can use this device, and then their prescription should include something for astigmatism as well. And fluorescent staining is a drop that you can put in the eyes, in the cornea, and if you see any kind of damage in the cornea, then the eye drop stays there, and that way you know where was the damage. And a slit lamp microscopy, this is, you put your chin here, and then the optometrist will go and look at inside your eye, so it goes to the anterior chamber, posterior chamber, lens, vitreous humor, and also all the way to the retina, so it can look at different part of the eye, and it's very important for diagnosing different conditions. The procedures, one is called keratoplasty, which is the fixing or repairing cornea. Usually you remove the cornea and you put a new one. Cornea does not have blood vessels, so usually the transplant is good and the rejection is low. Iridoid sclerotomy is that cutting into the iris and sclera. LASIK is that if somebody has myopia, then you can do, you can remove body superficial layer, well, one layer of the cornea. Usually it is the inner side, but the inner part of the cornea, you will remove it. You don't remove the deeper layer, just a superficial layer from inside cornea is removed, and the person can get very good vision. Inoculation is that if somebody has, for example, severe trauma of the eyes, cannot be repaired, or have a tumor, then they can remove the eyes. And strobotomy is to make an incision in the eye muscles and fixing strabismus, so the two eyes can move in the same direction, and that will be helpful with lazy eyes as well, but if it is done very early on. Once the person is older, after age 8, then it will be more difficult to treat lazy eyes. Ophthalmic solution is that you have it for different reasons. You can have it a drop, for example, for bacterial infection, for glaucoma. You can have it for dilation of the iris. R is just artificial tear, so you can have different medication. Overall, they are called ophthalmic solution. And ophthalmic decongestant is specifically for reducing the dilation of the blood vessel, so it's constrict, and this can be used like allergic conjunctivitis to reduce the redness of the eye. Artificial tear is for dry eyes. They can put tears, and that will improves the itchiness and dryness of the eye. Myotic is to constrict pupils, and mydriatic is to dilate the pupil. So this is when you go to an optometrist and ophthalmologist, they usually look inside the eye, and they can put a drop of this medication, and that will dilate the iris or the pupil, and then they can see inside the eyes. So the ear, you can look at these, review these terms yourself. I will start with the anatomy part of it. So the ear has three different parts. One is the external ear. This is the external ear. This is the middle ear, and this area is the inner ear. So the external ear is made of auricle or pinna. So this is the pinna. This is the external auditory meatus or external auditory canal. So this is collecting sound, and this is transmitting sound to the inner ear. And inner ear is separate. I mean the middle ear, sending the sound to the middle ear, and the external ear is separated from middle ear by the tympanic membrane. The ear is located inside the temporal bone, by the way. So the mastoid process is part of the temporal bone. Middle ear is a cavity. It's made of three different bones: malleus, incus, and stapes. Stapes is connected with the inner ear. There is also a tube there that's called eustachian tube, or pharyngotympanic tube, or auditory tube. There's different names, and that is balancing the pressure in the middle ear. For example, if you're flying and you hear popping sound in your ear, or maybe you're getting pain in your ear, that is because of the pressure imbalance between the two sides. So if you yawn or if you chew something like a gum, then the pressure by this area opens up, and you will feel less pain and discomfort. The inner ear has two different parts. One is called cochlea. This is for hearing, and this is for the nerve for it. It's called cochlear nerve. And the other part is for balance, and that has two different parts. One is called vestibule. So this is the spelling vestibule. This is the connection. Vestibular nerve is part of the vestibule, and the semicircular canals inside that. This is the semicircular ducts, and these two they have nerve endings, and both of them make the vestibular nerve. So vestibule is for linear acceleration and sensation against gravity, and semicircular canal is for moving of the head in three different directions, and there are receptors here, and the nerves that are coming from those receptors that makes the vestibular nerve. The two different specialty, one is audiology, that is the science of hearing, and if somebody has hearing loss, they go to audiologists. So the audiologists have a degree, a graduate degree in audiology. So about maybe around 5 years, 4 to 5 years of studying. And ENT or otorhinolaryngology, this is a science of diagnosing and treating ear, nose, and throat. Why all three? Because they are very connected and they are very close to each other, and if disease in one of them, then it can involve the other compartment too. The person that is specializing in that is called otorhinolaryngologist or ENT specialist, and that is a medical doctor that after finishing medical school, the person has to go through this training, and that's a 5 years residency, and they can also specialize another 3 years. So the sign and symptoms, one is otopyorrhea. Auto, as you know, means ear. Pyo is pass, and rhea is discharge. So they are getting this pass discharge from their ear, and that is bacterial infection. So that's a serious condition that should be treated with antibiotic, and if not working, you have to drain the pus. Autorrhea is bleeding from ear, and that is most of the time is from trauma. Sometimes it can be from like cancer and things like that. Tympanorexis is rupture of the tympanic membrane. That can be from a very loud sound, or it can be from sharp objects, or sometimes insects can also do that. Presbycusis is the loss of hearing with age, and this happens, and this is very common. There's a decrease in the movement of the ossicles, and also there is a reduction in the hair cells as with age, so that's why the person have hearing loss. Tinnitus is ringing of the ear, and so they hear some sound. That can be side effect of some medications, for example, aspirin, or it can be some diseases like inner ear diseases, which I'll discuss it later. Vertigo is dizziness or movement or a circular movement of objects that you feel around you. So it can be from cardiovascular problem, from inner ear problem, or it can be from nervous system, or it can be side effect of some medications. Ceruminoma is that collection of cerumen, which is the earwax, and if somebody is, instead of cleaning his ear, is pushing it more deeply, then there's an impaction of the earwax. The earwax becomes very solid and hard, and it will cause a conductive hearing loss. So the person will have difficulty hearing. Otitis externa is inflammation of the external ear, usually by a fungus, and that's common with swimmers, and that condition is also called otomycosis. So it's a redness and itching of the external ear. Otitis media, very, very common in children. There's two types. One is called serous otitis media, that is usually a virus, and the other one is called purulent otitis media, that is a bacterial one. So if the person presents with irritation, crying, or pain in the ear, and also if the child is very young, they cannot explain it, but they are pulling their ear and the ear is red, that could be otitis media. Otosclerosis happens in young to middle age, more common in Caucasian, and this is mobility of the ossicles inside the bone decrease, especially stapes, and there's fibrosis forms there. They don't know the cause, and if that happens, then the hearing is also affected. Acoustic neuroma has a similar sign and symptoms with Meniere disease. So they both have hearing loss, vertigo, and tinnitus. But acoustic neuroma, which is a benign tumor, also has headache. Meniere disease, we don't know the cause. So you have to do investigation, and that way you can rule out acoustic neuroma, and then you can diagnose Meniere disease. So you have to rule out other diseases before you can diagnose Meniere disease. Labyrinthitis is an infection of the inner ear, and as I said before, inner ear has two parts. One is cochlea for hearing, and the other one is vestibule and semicircular canals, which is for balance. And if there's an infection there, so it will affect both of them, and they may have hearing loss and problem with balance. The test one is audiometry. This is the test of hearing. There's different ways to do it. If you want to do it correctly, the person has to go to a specialized rooms, and they are insulated, so they cannot hear any sound from outside, and they hear only sounds that are transmitted to that room through this device. So usually have a headphone and they can hear and they respond to different sounds. But in the regular clinic, a doctor can test hearing, and if there is a problem, then they can send it to an audiometry clinic so they can test it more accurately. So these are two different tests. One is called Rene test, and then these are tuning forks. And you hit the tuning fork on the bony part of your hand. Then you put it on the mastoid bone on the back of your ear. And once you cannot hear any vibration, then you bring it back in front of your ear, and normally you should still hear vibration. And if you cannot hear vibration, then there is a problem with your hearing. Another way to test that is called the Weber test, and here again you hit the tuning fork on the bony part of your hand and you put it on your forehead, and it normally the vibration or the sound you should hear it on both ears. And if you cannot hear it, and then the one side will be affected. There is a way to interpret this, but this is beyond this course, so I don't want to discuss it. It's a little bit complicated, but if you want to ask me, just ask me and I can explain it later. This device is called otoscope, and it has a light and it has a lens here, and you can put this inside the ear, and you can look at the external canal for any kind of insects, any kind of mass, wax, and also you can look at the ear drum tympanic membrane for signs of inflammation, redness, swelling. Movement is less likely to be seen with that. There's a different device that you can use it, that you should connect with this, and then you can see it. It blows air, so you can see the movement of the tympanic membrane. And also, if there's a rupture, you can see that. If there's any discharge coming from the tympanic membrane, you can see that. And the procedure is called otoscopy. So this is the procedure, and this is the device. A more complicated machine is also there, that they put the device inside the ear, and then they record the movement of the tympanic membrane, and that is called tympanometry. And so people who have otitis media, they can use this. And also if there's a problem with the ossicles in the middle ear, they can also test this. There are different treatments for different disorders of the ear. So cochlear implant, this is if somebody has a problem hearing, so there's a mechanical device, and that will stimulate the auditory nerve, and the cochlea is responsible for hearing. A laryngotomy is cutting into the, make an incision in the eardrum. So if there is any fluid accumulated in the inner ear and it's not treated with antibiotics, then you can do that. Otoplasty is repair of the ear, especially the external ear. Otic solution is that ear drop, so that can be an antibiotic, or it can be different other medications like steroids. Antiemetic is to reduce vomiting and also vertigo associated with that, and if it is related to inner ear. But those two conditions can be caused from many other places in the body, for example, central nervous system, or it can be caused by irritation of the gastrointestinal system. It can be psychological, it can be hormonal, from different parts of the nervous system. So you do not use that for those reasons, only if it is from the inner ear. And wax emulsifier is if somebody has a wax impaction, so that will make the wax softer, and then it's easier to be cleaned. So that's you can get it over the counter also. And if you have any question, please let me know. Thank you.